Hi, this is Dr. Duncan Ferguson. In this case, we're going to talk about Bradley. Bradley is a 7-year-old male castrated domestic long-haired cat, and his history was that he had had his tail amputated after maggot infestation several years before, and he lost sensation in the tail. And his stools had been of normal consistency until the past year when they became loose to watery. Recently became inappetent and lethargic and was diagnosed with pyelonephritis, infection of the kidney, and was treated with an antibiotic and subcutaneous fluids. And his clinical condition improved from this, but no further diagnostics, such as urine culture or creatinine or anything like that, had been performed in the meantime. So today, when he presents, he's lethargic and inappetent, and the owner had noticed that the abdomen seemed swollen. On physical exam, he's bright, alert, responsive, temperature is normal, pulse fine, respiration maybe a little bit elevated. His weight is about 3.5 kilograms, and his body condition score is 2 out of 9. The mucous membranes were light pink. He had tachy refill, and the refill time was over 2 seconds, which is abnormal. And he was determined to be 8% dehydrated, somewhere between moderate to severe. No ocular nasal discharge, mild ceruminous debris in both ears, nothing found in his oral cavity, some gingivitis found, and his lymph nodes were normal in size. Continuing the physical exam, the heart had no murmur or arrhythmias, and the cat had strong synchronous pulses. He had in some normal roncovesicular sounds, but no crackles or wheezes, and a normal respiratory effort on the respiratory system. The rectal exam showed very hard feces present in the colon. Urogenital exam was normal. Musculoskeletal showed that he was slightly thin, and he had a normal gait. Neurologically, he was normal, and he was showing appropriate mentation. Continuing on abdominal palpation, very significantly, had firm feces in the colon on the left side of the abdomen and distended firm mass on the right side of the abdomen, but no fluid wave. His thyroid glands palpated normally, and on the pain scale, he was about 3 out of 10. So some additional diagnostics were done. Electrocardiogram showed a normal sinus rhythm, and his blood pressure was normal systolic. A stat metabolic profile showed a metabolic acidosis, moderate to severe azotemia, increased creatinine and BUN, mild hyperkalemia, and hemoconcentration. Abdominal ultrasound showed a severely distended bladder, distended colon, and no free air or fluid was observed. Complete blood count showed a leukocytosis with neutrophilia. Biochemistry showed that azotemia, low albumin, increased phosphate, and a slightly decreased calcium. His T4 was undetectable, which is not surprising. It's not likely that he had hypothyroidism. Cats aren't prone to that, but more likely that this was associated with his low T4 state of a non-thyroidal illness. Urinalysis showed urine, yellow and cloudy urine, specific gravity close to fixed range, protein +1, 0 to 3 white blood cells, and a moderate amount of bacteria. A urine culture was submitted, and those results were pending at the time, and we'll see those later. Whole body radiographs are shown in the next slide, and they were taken after the bladder distension was relieved by manual expression. So these are the ventral dorsal on the top and the lateral, left lateral on the bottom. And the thing that you should note here, and I'll circle it, is the obvious increased size of the colon full of feces. And on the ventral dorsal view, we can see fecal material basically anywhere from here to here. So he clearly has what is called a megacolon. The urine culture and sensitivity came back subsequently and showed an Enterococcus species, um, and this was shown to be susceptible to the fluoroquinolone um, and rofloxacin um, at a fairly reasonable dosage concentration, and yet resistant to the cephalosporins, somewhat susceptible to the combination of amoxicillin, clavulanic acid, and ampicillin, and also to trimethoprim sulfa. So keep that in mind when you look at what was done later on. So the questions that I'd like you to address are to, first of all, list off the top four um, problems that are perhaps life-threatening to this cat. Give about two differential diagnoses. There may be others. And then lay out in your mind a treatment plan, prioritizing between a short-term and a long-term therapy, and be as specific as you can about the mechanisms of the drugs that you're using or the other types of therapy that are not drugs. In the next video, what I'll be doing is going over these questions with you, giving you my perspective of them and what was actually done in the case. But I think it's useful for you, particularly in the context of your GI physiology that you're learning about at the same time, to think about what's going on in this cat, what the significance of the changes would be, what kinds of therapies you might apply, really focusing back on the basic information that you found in the GI presentations within the GI bootcamp.